Welcome to the Concussion Discussion. Concussions are a fact. They occur from falls, car accidents and other incidents. They also occur during sport and other recreations, acknowledged by national and international sporting bodies. I'm not attacking any activity or discouraging participation. I'm encouraging participation with concerns for our brains. I've had multiple concussions. I know the side effects and do not want to see others go through the issues that I have had to face and am facing. This presentation is a tip of the iceberg. That is concussion. I give it for educational purposes, my part in the exploration and education about concussion. My hope is that people will understand the serious nature of concussion. There are 15 concussion questions in this discussion. Some of you have already answered these in my concussion questionnaire, and I thank you. Details and answers will be given as we progress, along with some statistics. Concussions are serious. They must not be dismissed as a head knock or a bump on the head. These myths need to be eliminated. Question 1. Brain injuries cause more deaths than any other sports injury. True or false? True, according to the Brain Injury Research Institute. The Australian Institute for Health and Welfare has found 17% of all deaths result from head injuries. Every 4 minutes, an Australian is hospitalised with a head injury. Concussion question 2. What percentage of patients are not recovered at 3 months? Answer is B, 40 to 50%. As many as 40 to 50% of concussion patients are not recovered at 3 months, and there are large differences in the percentage of recovered subjects over studies, according to the University of Rochester Medical Centre. Considered in comparison to other brain disorders, mild TBIs are more common than stroke, multiple sclerosis, and Huntington's disease combined, giving it the dubious distinction of the most frequently occurring brain disorder, according to the Journal of Head Trauma Rehabilitation. This information is not meant to scare people away, but keep you informed about concussion and its potential effects. It is intended to inform, so you might prevent concussion, identify the injury, and assist others towards a positive recovery, and know why. A concussion is a closed head injury, a form of traumatic brain injury in which external forces apply to the brain, causing it to move in some fashion, causing strain, either through twist or torsion. This may be a sudden change in velocity, a low velocity impact to the body, or an impulsive blow in which the body is struck and forces directed to the head. This results in a functional disturbance rather than a gross structural injury, though there is damage on a cellular level. The symptoms presented are of neurological nature, and the individual often does not lose consciousness. The symptoms are transient and will resolve spontaneously. This is my definition, drawn from various sources. To understand this rather long definition, we need to look at its essential elements. It's a closed head injury. This means the skull is not breached. In an open head injury, the skull is penetrated. It's a traumatic brain injury, or TBI. Any traumatically induced structural injury or physiological disruption of the brain or brain function. It's from external force applied, meaning that it does not come from a disease from within. Causing strain, the brain moves in a fashion within the skull, forces directed to the brain, even from the body. Functional disturbance rather than gross structural injury. Cellular damage is exhibited in neurological symptoms. Transient symptoms. They most often do not remain. They resolve on their own accord with proper attention to recovery. Question 3. Does a minor concussion need to be taken seriously? Yes or no? Answer is yes. Every concussion needs to be taken seriously. The classification of mild, moderate, and severe are terms for triage of the condition, not for getting an idea of how serious a concussion is. This is a brain injury. Question 4. A stroke to the body can cause concussion. True or false? Answer is true. Most important takeaway from the definition is there is no mild concussion. This is a brain injury we're talking about. Grades of concussion are medical terms used for triage, for treatment, and for recovery. What causes concussion? Concussion is caused by an external force resulting in the rapid acceleration and deceleration of the brain, resulting in injury. The type of force influences the potential for concussion. There are two types of force, linear and rotational acceleration. Linear acceleration is a force which is directed in a straight line. This is most likely from a straight thrust. Rotational acceleration is where the brain moves in rotational motion. This can occur when a thrust or cut is made to the head and it rotates, even slightly. Angular attacks are more likely to result in rotational acceleration. Due to the torsion of the brain, rotational acceleration is substantially more likely to cause concussion. Both cuts and thrusts are cause for concern. Sudden change in direction causes the brain, resulting in damage. A cut may have more strength behind it, but a short, sharp thrust can result in damage due to the sudden impact. We must consider the nature of the blow, its angle, where it impacts, and the movement of the combatants, not just strength. Concussion causes inflammation within the brain. True or false? The answer is true. Strain in the brain results in cells breaking down, blood flow is impeded, and inflammation occurs, just like any other injury. The brain can move from one side of the skull to the other, resulting in an injury on the other side, a counter-coup injury. This strain of brain caused by torsion results in diffuse axonal injury, or DAI. These axons are what connect the neurons together in the brain. This damage is the reason there is a functional disturbance. This damage is on a neurological level. The brain is especially vulnerable after a concussion. True or false? The answer is true. Your brain is more vulnerable to concussion while it's healing from previous concussion. A second concussion occurring while you're healing from a previous results in accumulated damage. It's not like cutting your finger twice, it's more like breaking a bone while it is in the cast. Except, this is your brain. What are the risk factors for concussion? 1. Contact sport. 2. Females, the biological sex, are more likely to incur concussion than males. Female brains are more affected by concussion than male brains due to anatomic, endocrinologic, and physiologic differences. Males increase their likelihood due to their activities. 3. ADHD, migraine, and other medical difference. Individuals with ADHD have been highlighted in concussion risk, symptoms, and recovery. Those who suffer migraines and other medical issues, especially those which affect the brain, are also noted. 4. Concussion history. A person who has previously sustained a concussion is 4 to 6 times more likely to sustain future concussion. Every concussion increases your risk of future concussion. A concussion history is significant. This increases the likelihood of long-term effects, including post-concussive syndrome and lifelong effects. This is the reason, according to some, I should have stopped years ago, and the reason I am talking. I don't want people to go through what I have been going through and am still going through. However, everyone has choice. Post-concussion. This is the most dangerous time for a person with concussion. The reason a person with concussion needs to be immediately removed from activity. A second concussion is not only cumulative, but potentially lethal. We all want to return to activities, and waiting can be frustrating, but returning too early can result in further damage and further waiting, even potentially not returning at all. You should wait the full recovery before returning to play, or RTP, where there is a chance of a blow to the head. Following the advice given for a proper recovery and returning fully healed is the only way to avoid this risk factor. Who is at risk from concussion? A. Heavy combatants. B. Fencing combatants. C. All combatants. The answer is C, all combatants. Where blows are aimed at the head or may impact the head, there is a chance a concussion will occur. A misstep, mistiming, any one of several factors can cause result. All combatants are equally at risk. I'm not trying to scare people off. If that was the case, I should have stopped years ago, or not begun. Why do we need to prevent concussion? There are problems post-concussion for the short-term, long-term, and potentially lifelong periods. Concussion damage lingers. Long after the expected recovery time, there are deficits, even 1 year after the injury. Those without a proper recovery and post-concussive syndrome are significantly worse than those with good recovery. PCS can last for years if not treated properly and become chronic. Neurological damage begins with the first concussion. Damage can potentially affect any part of the body. Neural pathways remain damaged, so the brain needs to work harder. Cumulative effects. A history of concussion means longer-lasting symptoms. They do not clear as quickly as the first concussion, and you're more likely to suffer from long-term effects. Impairment in the short to medium term is seen in visual, memory, and tandem gait in the short term. The TG test is when we walk with one foot in front of the other along a line. If concussions occur without time to heal properly, the damage remains. Cumulative damage expresses itself in long-term cognitive and neurological effects. Second impact syndrome, or SIS, can occur when a person with an unhealed concussion receives another blow. This results in a cascade causing the brain to swell rapidly, the person to fall into a coma, and death. Brain disease and concussion. CTE, or chronic traumatic encephalopathy, is made known by the late by the movie Concussion starring Will Smith, addressing cases of CTE in American footballers. CTE is a neurodegenerative disease, also known as dementia pugilistica, or boxing dementia, involving neuropathic changes including cerebral damage, cortical damage, and other scarring of the brain. This is caused by repeated head trauma. Of the most famous incidences of Parkinsonism in the sporting world, the most famous is Muhammad Ali. Most compare to themselves and have the "it won't happen to me" response. There is a relationship between concussion and Parkinsonism, especially when there is loss of consciousness or post-traumatic amnesia occurs, with the increase in severity in the injury. Concerning Alzheimer's disease, this disease has certain genetic factors. However, head trauma is the highest likely environmental cause for Alzheimer's disease to spontaneously appear. Other neurological disorders can eventuate because the brain is disturbed. If the recovery process is not followed properly, there can be further issues, especially where there is repeat concussion. These are the consequences. These are the other consequences of concussion, and the reason we need to focus on prevention. How do we prevent concussion? PPE, or personal protective equipment, is the last defense. PPE is usually the first answer. It doesn't work for concussion. PPE does a wonderful job for what it's designed. Fencing masks protect people from penetrative and lacerative injuries. Helmets protect people from open head injuries and other damage to the skull. None are designed to prevent concussion. According to the British Journal of Sports Medicine, no protective equipment was found to convincingly prevent sports-related concussion, or SIC. More discussion of this subject will occur later. Extra padding in a helm will prevent concussion. True or false? The answer is false. When a blow impacts, the head moves with the helm. The padding doesn't get time to impress, so more padding doesn't help. A heavier helm may address some of the linear force, but increased mass makes the individual more susceptible to whiplash injury and rotational forces. Reduced perception is also a problem, especially when it reduces the perception of concussion. Prevention myths. Evidence for mouth guard's effect in preventing concussion is speculative at best, according to the National Academies Press. Will strengthening my neck improve the chances of preventing a concussion? Yes or no? The answer is no. According to the British Journal of Medicine, strengthening your neck will not prevent concussion. What are the symptoms of concussion? Recognizing a concussion is the first step in getting a concussed person to assistance. Everyone should be familiar with these symptoms. Concussion symptoms include headache, dizziness, reduced attention and concentration, slowing of cognitive processing speed or slowed reaction times, general feeling of fatigue and lethargy, light sensitivity, nausea and or vomiting, sleeping more or less than usual, or difficulty falling to sleep. A person experiencing any of these symptoms should be immediately removed from activity. It is better to be safe than sorry. Of course, first aid principles must be maintained. Everyone will not necessarily present with the same symptoms. The injuries are as unique as the people who receive them. There are medications and illnesses which may ape some of these symptoms. The question is whether there are new symptoms. Red flags. Red flags include loss of consciousness, no protective action taken when the athletes fall into the ground, impact or seizure posturing, balance disturbance or motor control incoordination, confusion or disorientation, dazed / blank, vacant stare or not the normal cells, memory impairment, behavioral change atypical of the athlete reports significant or new progressing symptoms. Red flags identify a person who has received a concussion and needs to be immediately removed from activity. Any individual who presents with a red flag should be sent to receive immediate medical attention and must not return to play until they have been cleared by a medical professional. There are some other symptoms. These ones should have a person go straight to an emergency room. If an individual experiences any of the symptoms presented below, especially after a head impact or impulsive force is directed to the head, they must be taken straight to an emergency room or have an ambulance called. Neck pain, increasing confusion, agitation or irritability, repeated vomiting, seizure or convulsion, weakness or tingling / burning in the arms or legs, deterioration of conscious state, a severe or increasing headache, unusual behavioral change or double vision. These symptoms indicate a deteriorating condition and potentially serious neurological damage. Question: a loss of consciousness is required for a person to have concussion. True or false? The answer is false. Only about 10% of people lose consciousness when concussion symptoms occurs. May take at least 48 hours to develop. True or false? The answer is true. Sleep disturbance is noticed because the symptoms of concussion may take 24 to 48 hours or longer to present. The answer is true. An individual who initially presents with symptoms but does not maintain them should be set out for at least 24 hours. Anyone suspected of concussion should not return to play until diagnosed as having concussion by a medical professional. Everyone needs to know the symptoms of concussion so everyone can identify a potential concussion when it occurs. This improves the safety of the overall activity. The Concussion Recognition Tool 5, CRT5, has become required knowledge for all authorised fencers in the SCA in LOCAC. This means every fencer should be able to recognise the symptoms of concussion. This is the beginning of the community protecting itself. Learn the symptoms, help your friends, help yourself. The answer is true. An individual who initially presents with symptoms but does not maintain them should be set out for at least 24 hours. Anyone suspected of concussion should not return to play until diagnosed as having concussion by a medical professional. Everyone needs to know the symptoms of concussion so everyone can identify a potential concussion when it occurs. This improves the safety of the overall activity. The Concussion Recognition Tool 5, CRT5, has become required knowledge for all authorised fencers in the SCA in LOCAC. This means every fencer should be able to recognise the symptoms of concussion. This is the beginning of the community protecting itself. Learn the symptoms, help your friends, help yourself. What is the process from recognition to recovery? The Concussion in Sport Group, or CISG, has 11 steps or 11 R's: recognise, remove, re-evaluate, rest, rehabilitation, refer, recover, return to sport, reconsider, residual effects and sequelae, and risk reduction. We will address from recognise to reconsider. Recognise. Again, it is imperative that everyone in the organisation should know how to recognise a concussion. Remove. The second stage is to IRFA. Sports Medicine Australia's policy is, if in doubt, set them out. Delayed removal from activity, or DRFA, results in significantly longer, worse symptoms and risks a second hit. Re-evaluate. The person must be re-evaluated regularly with the same assessment to check for progression of their symptoms. They must not be left alone. They must be accompanied by a responsible adult to monitor changes when they return home. Refer. A person must be referred to a medical professional for diagnosis. Only a medical professional can rule out a concussion. Rest. The current treatment for concussion is cognitive and physical rest as soon as possible. A lack of rest exacerbates the condition and symptoms, resulting in longer recovery time and post-concussive symptoms. Physical rest is evident. Cognitive rest is anything requiring concentration. You must avoid working or studying. Screen time falls within this category and as does loud music and bright lights. The period is until the symptoms abate, dependent on the individual. Recover. Once symptoms have abated, attempt further activity, slowly progressing. If at any stage symptoms reoccur, drop back to the previous. A follow-up consultation may be required if symptoms do not abate. The biggest risk for weapon-based martial arts is a loss of motor control. This does not return to normal for an extended period, hence recovery and return to play processes. You are a potential risk to yourself and others. Take the time to ensure you're fully recovered. Reconsider. A single concussion has serious adverse effects on an individual's life. Return to play could exacerbate these issues. Likewise, a person who has suffered cumulative concussion must consider whether they should RTP. Choice and consequence are present. Question: if you think you have had a concussion, you should see a medical professional. True or false? The answer is true. Only a medical professional can make a diagnosis. Assessment tools like the CRT5 are for assessment, not diagnosis. A person with suspected concussion must not return to play the same day. Question: you should get medical clearance to return to your activity after your recovery period has ended. True or false? The answer is true. You're only cleared to RTP once you've had medical clearance. Return to play. Early return to play results in potential for more damage, a longer recovery, and potential lifelong effects. Take the time to go through the process of recovery and RTP. The RTP process, it must be a graded process. Restrictions are not intended to restrict, but to protect. A specific RTP protocol must look at the person's return to the activity and the individual's RTP. A general guideline could look like this. Stage 1. After medical clearance, the individual should be introduced to simple physical movements, such as solo drills. Stage 2. Once sufficient control over a period has been demonstrated, they should be allowed to engage with other than simple drills. Stage 3. After another period, they should be allowed to engage in more vigorous activity. Stage 4. They must not engage in full activity until after their RTP has been complete. At any point, should the symptoms be exacerbated, they must drop back to the previous stage. Question. A person with long-term issues from concussion should not return to participating in their activity even if they are interested in participating again. A. True. B. False. C. It depends. Answer. It depends. This is no call for people to stop, but for people to seriously consider their activities and their health. Is participating worth the gain in comparison to the potential consequences? In my case, yes. This discussion has not been meant to scare, it has been to inform, to show there is hope. I do not have all the answers, although I do have some recommendations. 1. When considering approach to an activity, apply the risk hierarchy, which will be shown below, when looking for a solution. First, change the policy. Change the policy and rules to be changed so blows are hard enough to cause concussion are sanctioned. B. Change the people. Change the culture so hard blows are culturally unacceptable that injury reporting is encouraged. Individuals are trained to be not to be concussed and not to concuss others. C. Only then look at changing equipment. This is the last offence, not the first point of call. C. 2. Don't hit so hard. You only need to communicate the blow to your opponent in sufficient fashion that they understand they have been struck. It's a sword, not a club. 3. Do some research. Create an informed opinion. Decide whether the activity is safe enough for you to participate. This is my 3 points. This is my 3-point summary. If you want something more in depth, you should read my paper, The Concussion Discussion. The anything from a win attitude is the reason the culture must be changed, along with the approach, rules and policy for effective concussion prevention. Decision makers must make a concerted effort towards encourage organisations in positive directions regarding safety in their cultures. Ask questions. The research is the best defence against the myths, and some of them are dangerous. Remember, a concussion is a concussion, regardless how it occurs. All of them are serious, regardless of any medical classification. Discussion points. I've put these here so people can discuss them in groups. More people are talking about concussion, the better it is. First, risk hierarchy, from the most effective and reliable to least. Policy and guidelines and rules, then changing people, then changing equipment, including personal protective equipment. Changing equipment is the least reliable and least effective, yet it tends to be the first option. This needs to change. Policy, guidelines, and rules. A concussion policy determines how concussions are addressed. It must establish protocols for ensuring medical care is sought and return to pay processes. It must include preventive measures. Rules must stipulate the standards of behaviour, and familiarity is vital. Individuals who cause injuries must be cited for their behaviour. The individual who threw the blade is always responsible. They must control their weapon. Changing people. Culture. Culture affects risk and attitude. Culture determines the injury rate. Though two rival cultures, anything worth the win and care of participant is foremost. Unfortunately, the former seems to be more present than the latter. Everyone affects cultures. Where males believe they need to not admit to issues they might be having, this is against advice. Immediate action will have better results. As half as many participants fail to disclose injuries or have delayed removal from activity. According to the American Journal of Sports Medicine, no seriousness is attached to concussion due to the culture. Changing people, coaches and training. The most important thing a teacher can teach is control. Coaches need teach explicitly and implicitly. If their method is aggressive and risky, so will their students. The coach's attitude towards an injury will also affect the player's attitude to concussion. PPE, the last defence. PPE is usually the first answer, yet according to the British Journal of Sports Medicine, no protective equipment was found to convincingly prevent sports-related concussion. These are some points for people to talk about. Have a look at your culture, have a look at your club, have a look at the rules, see what needs to be changed. Thank you for listening to the concussion discussion. I hope the information has been informative and people will gain a greater understanding from this video. My purpose here is to inform people, not to scare them. I thank you again.